first surgery that I had to lengthen my right femur, I did 8.4 on it, and then on my left tibia.
So this is my second surgery, and initially in the first 5 days I have a little bit of pain. Also in my first segment I have more pain in my femur compared to tibia. Femur is more painful or tibia is less painful.
What do you want to say about the second segment? First segment was better for you or second segment?
The first segment was not so good.
Just want to ask you, what is the benefit of this cross lengthening? And nowadays I'm seeing people are posting video, they have just one patient and they're showing their fancy room. They don't have even experience, give them some cheap price or something. What do you say on that thing, on hygienic or height increase info?
I think that the hygiene at DHK is very good because they have very good caretakers and cleaning.
Hello, I'm Dr. Hirdesh from Height Increase Info. So we have two patients who choose cross lengthening. One segment is already completed for both, and he lengthened 8.4 centimeter in right femur and left tibia 7.6 centimeter. It's almost 16 centimeter target. And he lengthened 5 centimeter in tibia and 6 centimeter in femur. And now second segment is running. We will now review how is the condition right now, pain wise, activity wise, and how is going second segment. Start with you.
Okay, so hi everybody. First of all, it's a pleasure to have done the lengthening here in DHK because DHK is very good to help you with any questions, and especially Dr. Harry, he always is number one to assist you with any issues or any necessities. I did cross lengthening, so that means that you start with one femur, either left or the right, and you do the other tibia, vice versa, and then that way it's less stress on the body because you're doing different segments at varying different times, so it's just a little bit easier. So the first surgery that I had to lengthen my right femur, I did 8.4 on it, and then on my left tibia I did 7.7 centimeters. And you always begin with pain. The pain will gradually begin to go down as you become more active, and the more that you do physiotherapy, the more that it helps with the pain. I had a little bit of a complication with my nerve on my ankle on the left tibia, but Dr. Harry helped me very much quickly with the specialist, so now I'm fully able to tolerate the issues very low now, and it's almost gone. So I think it's going to be fully healed in maybe 1 or 2 more weeks or maybe 3 weeks. So, and then on the second surgery, I had very good flexibility bending my knee, but I have slight issues straightening my knee. So it's very important that you always keep your legs straight so that you don't face any form of deformity issues. You always want to keep your legs, whether it's your femur or your tibia, always straight at all times. Pain-wise, I'm having a little bit of pin cutting on my tibia portion, but that's just natural. So eventually your body will get used to it, and then you will always have a little bit of bone pain because the bone is lengthening. So when you're lengthening, you always get like growing pains and bone pain. So you'll want to make sure that you keep active in movement and that you don't stay in places that are too cold, because cold can make your bones can hurt your bones, it's very cold. So yeah, and I think the pain will vary it's very subjective and it depends on different patients. Some patients may be able to tolerate pain more than others. Initially, my body handled pain very, very well. Now, because it's been a long time, my body just wants to finish fast. So I'm just trying to make sure I do all the physiotherapy sessions that I need to do and make sure that I heal quickly. But yeah, the best thing to avoid pain is to ensure that you keep active and that you do all the physiotherapy sessions and that you eat right and that you get good rest. So that's my experience. But apart from that, it's a very good experience here in DHK, and I have no complaints. So yeah, thank you.
Okay, same question from you.
So this is my second surgery, and initially in the first 5 days I have a little bit of pain. It was more from the gas and the acid reflux issues that I have previously. It was not much related to the surgery, but when it gets sorted, there was no as such pain or anything that I have. And also, like, I think in this segment it's going much better than my first segment, because in my first segment I did not have very good bending initially, but in my second segment on the femur, my bending is really good. I don't have to do much of an effort to bend my femur. And also in my first segment I have more pain in my femur compared to tibia, but this time it is reversed. I have no pain in femur, but I have somewhat pain in my tibia. So I think in this surgery it depends. It's not always like the femur is more painful or tibia is less painful. painful. So it totally depends. And
So, what do you want to say about the second segment? First segment was better for you or second segment? Because in second segment you prepare, you know all the consequences. How
yeah, I think yes, that's also one thing that I.
and for you it's reverse, I think.
Yeah, so the first segment, it was learning experience for me, and because I had a ballerina, and so now that I know, now I wear my sandal 24/7. I sleep on it. As soon as the sandal comes off, I have nightmare. I have to like put it on, to avoid it. So it was a learning experience. But the best thing is you always listen to Dr. Harry and his advice, because you want to keep your sandal on to avoid ballerina, because then ballerina will slow down your healing. And yeah, for me, the first surgery was almost no pain, and the second surgery was when I really started to feeling the pain. Yeah.
Yeah, it was the opposite. Yes, the first segment was not so good. I almost took 3 months to reach 6 centimeters, which I could have done in maybe let's say 2 months.
Not 2 months. In 2 months you cannot.
More than that. And this time I think I will be able to get there a bit faster, but
Maybe you already prepare. You know how to handle this.
prepared. Yes, this time I think I'm used to the pain. Yeah, but it's not there. It's not that much.
So just want to ask you, what is the benefit of this cross lengthening according to you guys?
I think the benefit of cross lengthening is if you have a goal in mind, it helps you stay committed, because you can't just stop halfway and be like, I'm finished, then you're gonna be like walking weird. So that's one. It just helps you be committed, and also I think it will definitely help with pain, because I mean, if you do two tibias at the same time, I think that's manageable. But I do think that if you do two femurs at the same time, it will be more complicated, because you always have the issues with the bending and also moving. To move into the chair, you're gonna have to use your hip strength. So since you have a big nail that is here, both in the upper area and also the lower area of your femur, that always kind of hurts you when you move your hip around. And then also, I think cross lengthening just definitely lowers down the pain overall.
Yeah, I think I would say the same. And I think another thing is like if you initially came up with a goal of let's say higher number like 11 or something, or 12, maybe 12, 13. So and then if you only do like one segment first, and then maybe you will settle down, like I won't do right, and then maybe you regret later that I could have done it. I have time back then. So I think in cross you get committed. So when you get committed, you have to do it anyway. Like you cannot just leave in between. And on the comfort side, I think yes, you can take one. You can sleep on your one side. And yeah, this is pretty much the. Also, yeah, I think it's easier to roam around once you have cross. Like there's not like you are like.
That you can handle yourself easily.
Yes, that's it. Yes.
Okay. And nowadays I'm seeing people are posting video. They have just a one patient and just showing their fancy room. Yeah, we are providing fancy room and very hygienic, and they don't have even experience, but people are promoting nowadays. And I think patient also very happy, or they gave them some cheap price or something. What do you say on that thing? On hygienic, our height increase info? Because we are keeping two patients in a room. I think, according to me, I think two patients in one room, I think that's a better idea. And see, if I provide like 5-star hotel room for a patient, I don't think so that is useful for patient.
Right.
What do you want to say on that?
I think that the hygiene at DHK is very good, because they have very good caretakers and cleaning girls that clean in the morning.
But for a patient, I want to ask: is a 5-star hotel room, a single room, better, or a full dedicated team and full facility matter?
Oh yeah, I think the facility is more important than the 5-star hotel. Because at the hotel, there's no point in having luxury if you don't have treatment for your pain. You can be in the hotel but then be in pain. Yeah, and then also if you share rooms with another person, it always helps you mentally, avoid depression. I mean, it's different for people. Like I'm fine being by myself, but maybe other people, they want to talk to people and just keep company of others. But then overall, it also like helps them keep track of like their journeys and maybe talk about how they're feeling and support each other. So it's always good to share a room, I guess. But overall, DHK has very good services and clean. Everything is good. So yeah, I have no complaints. Also, the food is very good. Got the best chefs here.
Thank you. And what's your thought on?
I think yeah, I would say similar on similar points. Like it's not necessary like you need to have a hotel, but rather you should have a balanced. There should be a place where you could have access to all the necessary things that are revolving around the surgery. It's not like you they put you in a very luxury place and then there is nobody outside the door to help you, right? So I think yeah, there are like people only one.
I don't think so. Anybody want to be a guinea pig for a one patient. They don't have anything, and patient is going there.
So yeah, psychologically it affects you. Like I am the only one. you know.
Oh, I want to say, yeah, the HK is great because like my room feels like home. Literally, I have everything I need. I'm able to order my stuff that I need. I almost turned it into my room. Feels like it's my room. I mean, apart from just you will have the pain, but it's normal. Then the room comfort is very very good. I have zero complaints on the comfort in the rooms. So yeah.
And I like your bed also. 50 more than 50 supplements on your bed, along with you. And you want to give any advice for for those people who is looking for surgery?
Yeah, I think the best advice I can give is prepare your body with good nutrition and exercise and flexibility many months before you do the surgery. So I think it's very important that well, I mean, it's just personal advice. You don't necessarily need to do that, but I'm saying like if you keep your body nice and fit and active and you do your own stretches, then it's going to be easier for your body and your joints to adapt to the frames and and overall to the process. So I would just say maybe keep yourself active, and that will help you a lot, and keep healthy so it can heal fast. Make sure you don't smoke because smoking will not be good for your bones. This is for everybody.
Okay. And same thing from you.
Yeah, I would say the same. Like, just don't smoke. Be prepared. Like, take few months for your, just do some stretching. You have videos on your channel about the stretching that you can do beforehand coming to place, any place. And also like do your research. Just don't not go anywhere like where you are not sure about their track record or something like this. So make sure you do your research well, and then prepare your body also. Like just do not come very skinny and do not come very fat also. Just
It's skinny for you.
I came like normal.
come like oh yeah.
I mean, I have a full body transformation. I was I was decent. And now I'm very skinny, but I'll gain the weight back. I think. Yeah. Even the doctor yesterday, he said we're going to tell the chef to give you more food.
Okay, so this is his review. Now journey is running, going on. 2 more months, and for you,
Yeah, maybe a month and a half.
more months. So we'll post their final interviews once they completed their journey. And
Also, the HK is great because they do. Harry's awesome. He always helps you with anything you need. Because without Harry, I'd be lost. If it was somebody else that owned this place, like no. So Harry is very good, and they do the X-rays to check the process, and they help you. I really appreciate Harry because I had the nerve complication, and he really took the time to help me get treated. So thank you, Harry.
thank you. Your part is due. Okay, so if you have any query regarding limb lengthening, or you want to get taller, or you want to know anything from us, number is given below. Thank you.